This medication is used to treat tension headaches. Acetaminophen helps to decrease the pain from the headache, while Butalbital is a sedative that helps to decrease anxiety and cause sleepiness and relaxation. It is important to follow the recommended dosage and take it as directed by your doctor. It is typically taken every 4 to 6 hours as needed for pain relief. It is important not to exceed the recommended dosage to avoid potential side effects. It is best to take this medication at the onset of a headache for the best results. When taking Bupap, it's important to follow your doctor's instructions. You can take this medication with or without food, usually every 4 hours as needed. However, do not take more than 300 mg of Butalbital in a 24-hour period. The dosage is based on your medical condition and how you respond to treatment. It's best to use this medication as soon as you feel the first signs of a headache. If you wait until the headache gets worse, the medication may not work as well. If you suddenly stop using Bupap, you may experience withdrawal symptoms like nausea, vomiting, and mood changes. To prevent this, your doctor may slowly lower your dose. Withdrawal is more likely if you've been using this medication for a long time or in high doses, so it's important to talk to your doctor if you experience withdrawal symptoms. While Bupap can help many people, it may also cause addiction. This risk is higher if you have a substance use disorder. It's important not to increase your dose, take it more often, or use it for a longer time than prescribed. If you notice that you're using the medication more often, experiencing more headaches, or if the medication is not working as well, let your doctor know. They may need to adjust your medication or add a separate one to prevent the headaches. Some common side effects of Bupap may include nausea, vomiting, abdominal pain, lightheadedness, dizziness, or drowsiness. If any of these effects persist or worsen, it's important to let your doctor or pharmacist know. To reduce the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it's crucial to inform your doctor right away if you experience any serious side effects such as shortness of breath, changes in mental/mood, fainting, seizure, fast heartbeat, signs of infection, or easy bruising/bleeding. While a severe allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or you may report side effects to the FDA. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada. Now let's talk about the uses and dosage of Bupap. One of the ingredients in Bupap is acetaminophen. It's important to not take more than 4,000 mg, 4 grams, of acetaminophen a day to avoid serious liver disease. If you have liver problems or are giving it to children, it's important to take less acetaminophen. Make sure to ask your doctor or pharmacist how much acetaminophen is safe to take. It's important to not use any other medication containing acetaminophen without asking your doctor or pharmacist first, as it can be found in many non-prescription and prescription medications. Always check the labels on your medicines and ask your pharmacist if you are unsure. If you take too much acetaminophen, seek medical help right away, even if you feel well. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Also, it's important to avoid daily alcohol use, especially when combined with acetaminophen, as it may damage your liver. Before taking Bupap, make sure to inform your doctor or pharmacist if you are allergic to acetaminophen or Butalbital, other barbiturates, or if you have any other allergies. It's important to also discuss your medical history, especially if you have breathing problems, enzyme disorder, liver or kidney disease, substance use disorder, mental/mood disorders, or abdominal/intestinal problems. Bupap may cause dizziness or drowsiness and can be intensified by alcohol or marijuana use. It's important to avoid driving, using machinery, or anything that requires alertness until you can do so safely. Avoid alcoholic beverages and discuss marijuana use with your doctor. If you are planning to have surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects, especially drowsiness, which can increase the risk of falling. If you are pregnant, Bupap should only be used when clearly needed. Using it for long periods or in high doses near the expected delivery date is not recommended due to possible harm to the unborn baby. Discuss the risks and benefits with your doctor. Infants born to mothers who have used this medication for an extended time may experience withdrawal symptoms, so it's important to notify your doctor if you notice any of these symptoms in your newborn. Bupap can pass into breast milk and could have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of the potential interactions of Bupap with other medications. Certain drugs, such as darunavir, sodium oxybate, anti-seizure drugs, isoniazid, and ketoconazole, may interact with Bupap, affecting how it works. It's also important to note that Bupap can speed up the removal of other drugs from your body, which may affect their effectiveness. If you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, or antihistamines, let your doctor or pharmacist know. Additionally, Bupap may decrease the effectiveness of hormonal birth control, so it's important to discuss with your doctor if you should use additional reliable birth control methods while using this medication. It's also important to be cautious with other medications that may contain ingredients that cause drowsiness, and to speak with your pharmacist about using those products safely. Lastly, Bupap may interfere with certain lab tests, so make sure lab personnel and all your doctors are aware that you are using this drug. If you suspect an overdose and notice symptoms such as passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. U.S. residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. Symptoms of an overdose may include severe drowsiness or dizziness, slow or shallow breathing, nausea, vomiting, loss of appetite, sweating, stomach or abdominal pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. Remember to seek immediate medical attention if you or someone else experiences any of these symptoms. It is important not to share Bupap medication with others. Bupap can be used to relieve tension headaches. It is recommended to consult your doctor or pharmacist for more details on how to manage tension headaches. While taking this medication, you may need to undergo lab and/or medical tests to monitor your liver and kidney function. It is important to keep all medical and lab appointments and consult your doctor for more details. Bupap is a combination analgesic medication used to relieve moderate to moderately severe pain. It contains two active ingredients, acetaminophen and butalbital. Acetaminophen works to reduce fever and relieve pain, while butalbital is a barbiturate that helps to relax muscles and ease tension headaches. Bupap is typically taken every 4 to 6 hours as needed for pain relief, and the dosage should not exceed 6 tablets in a 24-hour period. It is important to follow the dosage instructions provided by your doctor or pharmacist. Bupap can be taken with or without food, and it is best to take it at the first sign of pain for the most effective relief. It's important to store Bupap at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When you no longer need it or it's expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.